I'm State Representative Dan Sullivan here with the Liberty Moment. I'm here on campus with Professor Mitchell with the Arkansas Center for Research and Economics.
Yep, thank you.
You're an independent research group based here at UCA.
Yep.
You've studied a lot of these healthcare and scope of practice issues. If you could change some of those laws or regs in the state of Arkansas, what would they be?
So the most straightforward thing to do would be to relax or the stringency of scope of practice regulations for nurse practitioners. And scope of practice rules, those are just the rules that say what one profession can do versus what another profession can do. And Arkansas has very strict scope of practice rules, so much stricter than the other states.
Compared to other states, where does Arkansas rank in that? Are we more liberal? Or
we're one of the least liberal, not the least liberal, but one of the least liberal on customer choice for which provider you want to work with.
So how would it benefit the average Arkansans if we change the scope of practice rule?
So allowing more nurse practitioners to do more things would allow Arkansans to broaden the number of providers they could go to, improves their access to care, improves their ability to get good appointment times, and it improves their ability to find the practitioner that's right for them, that has the right.
So you hear a lot about, of course, we improve access to care. I guess the other issue out there is quality. How does the quality of care for an Arkansans compare when they see an APN?
So an APN is advanced practice nurse, and some of those are nurse practitioners. Those are the ones who focus only on primary care. So that's the care you get before things get serious, including preventative care. So the problem for Arkansans is we don't have as much choice as other places, and the evidence shows that nurse practitioners provide excellent primary care. Empirically, they provide good care. Patients like them. The Institute of Medicine recommended using more nurse practitioners and broadening their scope of practice, and the National Governors Association recommended the same thing.
We have another guest with us here also. Mary Garnica is here. Mary, could you come and join us?
Sure.
You're an advanced practice nurse here in the state of Arkansas.
That's right.
Could you tell us a little bit about the impact to Arkansans if this scope of practice was expanded?
Probably the most important impact is it would open up access to care considerably. Advanced practice nurses have been providing safe, quality health care in the United States since the 1960s and achieving wonderful patient outcomes.
Great. We appreciate you being here. This is Dan Sullivan on campus at UCA with the Liberty Moment. Thank you all very much.